It's the Missouri Credit Union Miracles for Kids Radiothon.
Thank you so much.
On Y107.
You never know when you may need the help of MU Healthcare, and you can do that, and you can put your proceeds to that. If that ever happens to you, you need their assistance, their care. You can do that by becoming a Miracle Maker. 866-970-4483. Become a Miracle Maker right now. $20 a month. We have a special guest with us, Kristin.
We do. We actually have the Chief of Pediatrics with us today, Dr. Laura Hesemann. Welcome.
Thank you.
Hello. We were just talking off air about some of the patient care that you give, and I know now as Chief of Pediatrics, which you said you got last summer was kind of when you took over that role as well. And so now you're kind of in this more administrative position where you get to help kids get the care that they need, right?
Yep.
But you still work with kids too.
I sure do.
You sure do. There was one story you were just telling me that I feel like we need to talk about because I think a mobile dance party should be everything.
Absolutely, yeah. So I have a patient who unfortunately is in the hospital right now. She's been there a couple of weeks, and she has renal failure. She has complete kidney failure, and she's been on dialysis for several years, which is a lot for any kid to deal with and any family to deal with.
Yeah.
And she has had complications. She has other things in addition to her kidney disease. And so when she comes into the hospital, sometimes it's for long stays, she is a celebrity in the hospital, and everyone falls in love with her because she has so much personality. And as we were talking about earlier, yesterday when I was seeing her in the hospital, she and I were dancing in the hallways because that's what she wanted to do. And so we started out a couple days ago waltzing in her hospital room, and then yesterday in the hallways, I would say more of like a breakdown kind of dance. And she has put up a light up disco ball on her IV pole that she's pushing around with her and bringing the party everywhere she goes. And so every time things like that happen, I always laugh, and we talk about it in the hospital all the time. These are the really fantastic things that only happen in a children's hospital. Like the rest of the hospital, on the adult hospital, they are not having dance parties in the hallway, I assure you.
Although I feel like a mobile dance party should be brought to every wing, every business. They brought a mobile dance party through here.
I don't know why we don't have one here on the regular.
I feel like she needs to start a mobile dance party business. That might be her calling.
This girl could. If anybody can start a party business, it is her for sure.
Oh, and so we actually just talked to Lizzie Sue, who is a huge dancer, and we've also had a bunch of patients come through that talk about the music therapy and all of the different. There's so many different aspects of what goes into child services. Do you have one that you particularly connect with these patients?
Oh gosh,
we asked the hard questions.
Yeah. I would say I am so incredibly thankful for Child Life Services, for the art therapy and sort of the crafting part of it, because having a kid be able to actively do something and do something with their hands and something that lets them express themselves when they are in the hospital and in an environment where they don't have a whole lot of control over the situation, to give them back control, to let them be in charge of a project that they want to do. Sometimes it's doing a puzzle or creating a puzzle. Sometimes it's the bead necklaces as part of their journey when they're collecting beads and things. I can tell you as a mom, not just as a doctor, when my own daughter was in Children's Hospital, how much it meant to us when Child Life came in to help, because the expertise that they have is so specialized as the Child Life specialist that it was great for me. I'm a doctor and I'm a mom, and I still needed that help from them to help figure out the right words to use to help her get through that experience.
What would you say is your favorite part of the job?
Oh my gosh.
Again, we're loading you the hard question.
I would say the best part is when you are really down in the trenches, like in those lowest moments with the family, and then when they open up, getting to be there with them in that hardest part and being with them as they improve, and being the one who gets to help walk with them to the end of their journey, and seeing that transformation of, a day ago, a week ago, a year ago, we were kind of hopeless, and then we have these fantastic outcomes, and to see the joy on people's faces when they're getting back to normal life or when things are starting to feel regular again, that is by far the most rewarding.
We are talking with Dr. Laura Hesemann, the chief of pediatrics here. You keep hearing that Missouri vein care bell ringing in the background. We need that ringing so that child life that you were talking about, so that all these programs that aid you and what you do can stay at this hospital. We are looking for, I think we have 5 more minutes. We were trying to do a push of 10 calls in 10 minutes.
Yeah.
So get on the phone right now, 866-970-GIVE. If there's somebody listening, why would you tell them to give?
Because it really is true. Like you're just saying, you never know when it's your own child, your own grandchild, your neighbor, some child that you love. We are so incredibly lucky to have a facility like this, to have the expertise right here in our community in mid-Missouri, so that we can give kids that care, keep families together, keep them close to home without having to travel hours away. And so when it's your child, when it's somebody else that you care about, we need to support this.
And can you tell us, so no child is ever turned out. Can you kind of explain how important that is in an area such as mid-Missouri?
Yeah, gosh. Thank you for bringing that up. A lot of us think about that. There's a famous hospital nationally who that's sort of their tagline.
Yeah.
But it doesn't mean that we have to only devote our resources to hospitals that are very far away, when we have the same opportunity to support a hospital who is right here close to home, that is devoted entirely to the children of Missouri. There are wonderful facilities outside of mid-Missouri, and they are not as focused on rural Missouri like we are, because that is our mission. We are the Children's Hospital for the state of Missouri. We are the institution that is educating the next generation of pediatricians and nurses and child life specialists. And we know that educating them here in Missouri will keep them in Missouri so that they can serve rural Missouri.
Well, thank you so much for coming and talking to us today. Everything that she said, make sure that you become a miracle maker so that this hospital, your hospital right here in mid-Missouri, can keep on not only being here, but being able to provide such support for these patients and these families. 866-970-4483. Another Missouri vein care bell ringing there. It is the 18th annual Missouri Credit Union Miracles for Kids Radiothon on Y107.